Good morning, Digizens, and welcome to Responsible Business Summit 2020. Now, as we all know, responsible business is a core pillar of Digi strategy, along with growth, efficiency, and simplification, and winning teams. And as Digizens, we invest a lot of time over the course of the year to internalize our own aspirations and expectations of all of us on all dimensions of our strategy, no different from responsible business. Now, in all normal times, we will probably have the session physically, all of us coming together as a group, dressed in our yellow t-shirts as we do every year in Yellow Arena. Same thing we would have done this year, had it not been, of course, for COVID-19 and the changes it has brought into all of our lives. So we have online format this year for doing Responsible Business Summit. And we've put together a very good agenda with top experts on a range of topics across the spectrum of responsible business. I hope you've signed on to all of them. On behalf of DMT and the team around this, thank you for tuning in. Thank you for prioritizing your time. Then, let's go to the topic of our keynote today as well. Over the last few months, all our lives have been affected and changed by the spread of this global pandemic, which was also swiftly followed by several versions of lockdown, as we call it, movement control order in Malaysia. That has left some of us working from home, while others risking their health and safety, but also by working outdoors and in the front lines in order for vital services, essential services of the country to continue. Telecommunications was one of those, and in order for the rest of us to also stay safe. And looking at the bigger picture, when the life and health of populations are at stake, the clear message is that business as usual can't go on. And there's a need to ensure that normal operations do not erode health policies that are in place to control the spread of the disease and the risk of a collapse of the public health system. And then looking outside of Malaysia as well, we've seen some governments seem to promote an approach of saving the economy at all costs, including putting the health and lives of a majority of populations at risk and at stake. On the other hand, there are arguments that the extreme restrictions themselves have affected livelihoods of not only a sizable low-income segment of the population, but also other vulnerable segments. Which brings us to the topic of this morning's opening panel discussion. It's titled The COVID-19 Dilemma, Balancing the Economy and Public Health. And we are honored to have two esteemed speakers from the field of economics and healthcare to share their insights with us over the next 45 minutes. So please welcome with me, firstly, Dr. Jomo Kwame Sundaram, renowned economist and research advisor of Khazanah Research Institute, and Dr. Amar Singh. Amar is consultant pediatrician and senior fellow of the Gallen Center for Health and Social Policy. Dr. Jomo, Dr. Amar, welcome, and thank you for joining us here today.
Thank you for inviting us.
So let's start. I mean, I mentioned earlier, countries across the globe took very different approaches in dealing with the spread of COVID-19. Governments were scrutinized for what appears to be a really complex task of balancing public health and safety and the livelihood of the citizens. And then we've had our own experience in Malaysia as well with various versions of movement control order. And so I'd like to firstly hear your views on Malaysia's response and the measures implemented in containing the spread of COVID-19 from your perspective. So looking back over the last 6 months, how would you characterize the impact of COVID-19 for the world generally and for Malaysia? And maybe we start with Dr. Jomo first and then Dr. Amar.
Thank you very much for having me today. I think it's very important and timely that you should be having this kind of a discussion, especially because it has a huge impact on companies, particularly in your sector. Let me suggest that Malaysia was in some ways rather well placed because we have had a series of epidemics relating to virus outbreaks over the last quarter century or so, beginning from the late 20th century. So we had a series, some of the older ones will remember things like avian flu and SARS-1 and Nipah flu. Malaysia was very proud to be able to attach the word Nipah to that particular that particular outbreak. So in some senses, we were actually quite well placed. And as early as the 3rd or the 4th of January, Dr. Amar can correct me, the authorities actually announced that they were able to organize a quick response. One of the unfortunate things, however, in Malaysia, because the health sector has a lot to be proud of. It actually has done pretty well, especially in the early years after independence in terms of health indicators. And unfortunately, we have seen a relative neglect. And in addition, in the second half of February, there was essentially a coup d'etat, a change of government. And this resulted in about 3 weeks of policy inaction from the end of February until the middle of March or so. So we lost 3 precious weeks. And 3 weeks means a tremendous amount of impact in terms of the spread of the virus. There are many characteristics of this virus, which Dr. Amar can speak to much more competently than I can. But I think it is very important to recognize that what distinguishes East Asia and Kerala, state in southwest India, is the fact that in most of East Asia, except in and around Wuhan, there was no stay in residence, stay in shelter, lockdown imposed. This is very important for us to remember. So the actual economic impact was of a different nature, perhaps less debilitating than what we had in countries which imposed lockdowns for various reasons. So undoubtedly, there was stay in shelter lockdown in Wuhan city and the 3 surrounding provinces, because there are a lot of workers who commuted to Wuhan. And by the time the Chinese authorities recognized the epidemic and so on, a lot it had spread quite a bit, and it was necessary to have a lockdown there. So sharp, very targeted lockdown, which was quite effective, and then a great number of early action precautionary measures throughout the rest of China, and also I want to add about the rest of East Asia. So Japan responded very quickly, Taiwan responded very quickly. The virus had spread to Korea, and there was a super spreader incident involving a sort of semi-underground church. And that, of course, resulted in quite a number of infections and deaths in Korea. And we, of course, had a similar incident with the public so-called cluster. Now, what is important for us to recognize is that despite that, the authorities did act quite quickly. I have some hesitations on how many marks to give in terms of the response. But I think the Prime Minister, the current Prime Minister, protected the health authorities, and the role of the Director General and his team in the Ministry of Health and beyond, people like Dr. Amar, Dr. Musa, and a whole range of other people who have been very active on this front, is something to be very much appreciated. So we have a fairly high level of consciousness, and which could have been facilitated much more by better use of the media, both the broadcast media, the digital media, as well as the print media. And this is where I think a company like DG has a very important role to play. Now, beyond that, of course, we know the rest of the story in Malaysia. And the question of the timing of the lockdown and whether it was absolutely necessary, I would argue that if the measures which I was advocating at that time in the corridors of government, I was not a member of the government, of course, but I had some say in some of the response. I wish there was much more. There had been, even before the crisis, much more funds allocated to the Ministry of Health. The Pakatan Harapan promised a great deal in terms of healthcare funding, but it didn't really come through in any significant fashion. But there was a willingness to act as early as February, when the scope of the crisis was appreciated. Of course, there's much more to be said about what else could have been done and so on and so forth. My own view is that we should have better prepared the population for a gradual coming out of the stay-in-shelter lockdowns. The lockdowns could have been much more targeted, as they were in places like Vietnam, as well as in Kerala and elsewhere. And many things could have been done better. But I think on the whole, we have done reasonably well. We'll get into some of the other detailed issues later.
Thank you. Very good conclusion on that one, Dr. Jomo. Looking forward to picking up the point with you later on. Dr. Amar, may I then hand the floor to you? I know you have something to share with us as well.
Thanks, Joe, and thank you very much for having both of us on this show and sharing with your group. I'd like to maybe take the lens a bit further back. I expected what Jomo was going to say, and I'd like to quote 5 impacts that I see this epidemic having on the world and on Malaysia as well. First of all, I think this pandemic has defined governments. It's actually shown us what kind of governments we have in the world. And we look especially at New Zealand, Iceland, Taiwan, South Korea, Japan. We see the kind of leadership that we're looking for, especially I look at New Zealand, especially in this time. So I think this virus has shown the kind of leadership that we are looking for and that some countries have to handle the virus. And that's very important. It also shows the infrastructure you have developed in your country, especially to help the vulnerable groups, the safety nets that you have, the policies you have. The second point I'd like to make is that it's also revealed the kind of health service you have. It's unmasked your health service. And there are 2 parts of this health service. There's the intensive care, acute rescue service, and then there's the public health service. And again, we can see countries that have done very well are ones which have a balance of both of these. A very good public health arm, as well as a very, very good intensive care arm to deal with the very sick with COVID-19. We haven't done too badly. Our public health arm has always been a very strong arm of the Ministry of Health, but I wish that our intensive care arm, our hospital arm had been better funded and better equipped with this. So one area that I think we're a bit lacking. Thirdly, very sadly, what this COVID-19, the impact it's had is to worsen inequalities and worsen poverty. And I think that's something we must address, and we haven't addressed adequately in many parts of the world, including our own country. The poor have got poorer. They don't have the resources many of us have to deal with this virus. You can't just call Grab back every day if you're for food, if you're a poor individual, and you've lost your day wage. And this virus has unmasked poverty in a way that we've never seen it before. Fourthly, it's a virus that has both divided and united the world. It's a strange situation. We've all been united in the sense that this virus is something that we're all facing, and so we sense a sense of unity there, and we're in the same boat in a sense. But it's also divided us in the sense that there's a lot of xenophobia that we've seen, initially with China, but also in our own country towards migrant workers, as they see migrant workers positive. And so there's a lot of negative reaction to individuals. But I must say, I'm blown away by a lot of the acts of charity that I've seen. It's really brought us together. Some individuals and some groups have taken a lot of effort to reach out to those who need help. And so this virus has also not just united us, but also brought out some of the best things that we can see in people. And fifthly, the one that I worry the most, how this virus is created a time of great uncertainty and anxiety. I often think of this virus as the no-end virus or the no-win virus. You know, it's not 2 years. I was just listening to somebody talk about vaccines, maybe 5 years. Even WHO says maybe the end of 2021, we might start to see vaccines roll out. So imagine another 1.5 years of this kind of lifestyle that we're going to have to live. And so it's brought a lot of fear, anxiety, uncertainty, the catchword of our time. So I leave you those 5 thoughts as introduction of how it has impacted us. And I worry especially for the last one. Uncertainty eats into us, doesn't give us hope. And this is where we look to governments of the world to assure us that there is a way to move forward. Thank you, John.
No, thanks, Dr. Amar. And you certainly, in your writing as well, in your articles, you said that called COVID-19 the greatest challenge Malaysia has faced and probably the world has faced. I want to pick up on 3 points that you've advocated, which is crucial to a national response. And you said 3 things. One is physical distancing. Second is aggressive testing. And then the third is, how do we come together as a community to support the healthcare providers, support healthcare infrastructures, and frontliners in this war? How do you kind of comment on that, looking back over the last 3 months of Malaysia's own experience in COVID-19?
Thanks, Joe. I drew a diagram, a simple triangle, and said those are 3 sort of our key areas that we need to work on. And let me cover 3 of them and see how we've done. First, with physical distancing, I think we did initially well. I agree with what Jomo said. We came in with our MCO early, and I wish it had been a little bit earlier, but still came in at a good time. And we were forced, in a sense, we are forced to stay indoors, forced to do our physical distancing. But we're rapidly losing this. Even the Ministry of Health has expressed concern about this, that we are not, being as cautious about physical distancing as we have been. I think there are a number of reasons for this. One is there's fatigue. It's only so long that people can carry on like this. But secondly, I think we're not the most disciplined of societies. We're not the Japanese, South Korean, very disciplined. So I've been there. They're really disciplined. Even when they demonstrate, they're disciplined in their demonstration. And so we're kind of like...
But the UK and the Americans, though.
Yeah, we're much better than that. Yes, they're extreme. We're somewhere in the middle where this is. So I see we are losing. I look at more and more images and videos of what's happening in the Klang Valley, of people getting back to where life was. But I would say there are still pockets of people who are vigilant, but they're not significant numbers. I think the majority are going back to life as they see it. I'd like to say, if I were to rewrite the article, I would put physical distancing on par with masks. I think masks have, from all the data and the studies that are coming out, masks are as crucial as physical distancing in getting this virus and this epidemic under control. So again, with masks, I don't see us using masks as much as I'd like to. Secondly, aggressive testing. I think with aggressive testing, we've gone through a number of phases. Initially, we had difficulty getting our testing up to the mark. We struggled to get the numbers up, and our turnaround time was slow. We heard reports of people getting their results 5 to 7 days after the test was done, which is too slow. And then after a while, we got it up, and but we seem to have stagnated. I wonder if you could show slide number 2 for me for a moment. This is the last data set that we can obtain from the Ministry of Health. And you can see the 2 circles in red. Ministry of Health says they have about 37,000 tests that they can do per day. Notice how many that we've done on that particular day that was quoted. It's about 3,000 plus. So we're using about 10% of the tests that we have. Yeah, that's not very exciting. Thank you for showing the slide. So there are 2 issues there. One, we haven't ramped up our testing to the levels I expect. I expect today that we could do 100,000. Maybe even more. I want an overkill of tests available. And secondly, even though our numbers are low, we should use our tests to explore. We should go to groups which are not so well tested. We should test more frontline individuals, people who are working in service industry, in supermarkets, frontline people working in communication. Anyone who's working in the frontline, seeing a lot of people, the healthcare professional should be tested every 2 weeks as necessary. And then we should explore, residential care and migrants and so on. So
maximizing our testing to be far more accurate as well in where we test,
agreed.
Which are most exposed.
Yes, I think that you must recognize that if you look at what's happened in Melbourne, the outbreak has swung back. It swung back just because of a couple of people. Some people estimate there's only 2 individuals who brought back this huge second wave that they're having right now. So if we don't catch every individual out there and follow the New Zealand style of not control but stamping out or eradication, we're going to fail. And so we've got this 37,000. Why don't we just use them? I know it will fatigue our lab a little bit, but I think the more we pick up, the better it will be. And I'll show a slide later about how the virus can spread. And the third one I'd like to say is this issue of supporting our healthcare infrastructure and providers. Initially, when we started out, there was enormous concern, especially with personal protective equipment, PPE. Our staff on the ground was struggling, lots of videos and images, a lot of phone calls from colleagues saying they're doing do-it-themselves or homemade kind of stuff, which wasn't up to mark. That has improved. A couple of us also did a study to see how that is getting better. So we've got past that, but we've not really capitalized fully. We've got a lot of manpower that's available to us right now, and I would say that healthcare manpower right now is premium. But what we've done with manpower is left them on contract jobs. We've left doctors and pharmacists on contract jobs. We've not given them the reassurance. And if you're not careful, other countries may see this and take our manpower. I would hope that right now the government actually absorbs our manpower, all our contract officers, and make them permanent. Thirdly, I think one of the issues I'm still concerned about is we haven't seemed to grow our infrastructure adequately. And what I mean by that is intensive care beds. Yeah, our numbers are low. We've put aside a certain number of beds for intensive care for COVID, and we're not using them, sure, but that's today. If you look at any country, they can get overrun very easily, and that may happen to us as well when we open our borders and we go back to things as usual. So we need to actually act for that. We cannot assume that we will not be overrun. I like again the New Zealand Prime Minister has said there's no assurance that New Zealand will not be overrun by the virus, and she's pushing very hard to be prepared. And I think we have this lull period right now when the numbers are low. We should build hospitals. We should build intensive care. It's expensive, but if we do not spend the money right now, I suspect in the future we'll have to spend a lot more money to control. So those are what I think where we are at present.
Yeah, very good points, Dr. Amar, and I think we take note of that as well. But just swinging back to you, Dr. Jomo, on the point of the economy. I mean, all of this will come at a huge macro cost economically as well, not counting the social impact to very vulnerable, economically vulnerable sector of P40 communities, low or daily wage earners, for example. But at the same time, we are also sharply aware, reflecting on Dr. Amar's comments, on the cost to public health that cautions us against being too bullish too soon. So I wonder if you could guide us as a country and also as a company like Digi, as we start to reopen and start to reintegrate back to society. What should the factors be? What should we be considering as we open and reopen and recover from this?
Yes, thank you again. Let me suggest to you that many of the people who claim to know the future, I would not trust. You know, I think unfortunately economies are under the illusion that they know the future. Okay, I think you're better off with astrologers and economists. More seriously, I think it's very difficult to read what is going to happen. Amar has just reminded us of how complex this particular pandemic is. Every virus has its own characteristics, but this particular virus has its characteristics which make infection particularly difficult to contain. Part of the problem for many poor countries, for example, is the fact that testing and PPE, personal protective equipment and so on, is actually quite expensive. And it need not be so expensive, and this has a lot to do with intellectual property rights and things like this, which we won't get into right now. But coming back to the future, I think what I would strongly emphasize is thinking about what has been done and what needs to be done, and also realistically, we are not talking about returning to business as usual. We are not talking about so what this basically implies is that there's a huge challenge in terms of what should be done. We need to begin to think about to have not just conversation, but to actually implement policies to move the so-called new normal, if you will, in directions which are not only recognize the problems of the past, but also anticipate a more desirable future and to create the conditions for that. This, I think, is very important. And we should not take the public for granted. The public is aware, for example, that the atmosphere was much cleaner, that many of the rivers were much cleaner during the MCO period, and so on and so forth. Everybody has seen the videos of Penang, Sungai Pinang, and its discharge into the Penang Channel and so on and so forth. So people's expectations are actually quite different, and particularly because COVID-19 is also recognized as SARS-CoV-2. So recognizing that in a way it is some of the symptoms or consequences involve respiratory problems. But other types of respiratory problems have actually declined, at least within the Klang Valley, which is a bit of a pocket. We have seen people actually acknowledge that many of their problems have been relieved because of the cleaner atmosphere which we have seen. So all this basically means that people are not going to be comfortable with a return to the status quo ante. And this poses very important challenges. So I think it is very important for us to actually start planning and creating the enabling conditions to move towards a desirable future. Having said that, I think as Amar correctly pointed out, what has happened so far, not only with the pandemic itself, but also with the measures taken ostensibly in response to the pandemic, we have seen many groups which have been very adversely affected. I would estimate roughly a third of the population. Some people would say about half the population have basically had their livelihoods severely disrupted. Think, of course, of people who are petty hawkers, petty businesses, and so on and so forth, who are no longer able to continue those businesses. Some of them have actually done some innovative things. Instead of waiting for customers to come to them, they deliver to customers and so on. But these are measures, and this is where businesses such as yourselves have an opportunity to see how you can enable some of the new kinds of practices, which are obviously going to be needed. I think what Amar emphasized, that we're not talking. The Russians announced 2 days ago that they have completed the trials, and they may have a vaccine there. And there will be a lot of hype about these kinds of things, especially from the US, because Trump recognizes that his re-election prospects have really gone downhill. He had the highest ratings ever at the beginning of the year, right? After making the deal with China on trade and so on and so forth. And now he's in very, very serious trouble. There are Republicans who are talking about not attending the convention and so on and so forth. So he has invested a lot in his warp speed. So there's going to be a lot of announcements about, giving the impression that actually we have moved forward to vaccines and so on. But Trump has also revealed something which must be troubling not only the rest of the world, but also Americans. That he wants to control everything. He wants to control not only the vaccines, he wants to control, if possible, the production and supply of PPEs, not only for America, but if possible for the rest of the world, and also tests and treatment. So we are seeing many of those of us who are concerned about the abuse of intellectual property, we are seeing the ugly face revealed by all this. Okay, but as Amar also reminded us, we have now a very, very complex political situation which has obscured this debate, and instead it is being seen by many in other terms. So what can the economy do? I think from the government side, we need much more visionary thinking about what is needed. Unfortunately, this government is in a mode, understandably perhaps, of being very, very defensive, of ensuring that it doesn't lose the votes and so on and so forth. So some of the worst abuses of the past are now being writ large, and this is going to be hugely problematic. It's going to be hugely problematic, and it's going to stand in the way of making the kinds of policy decisions which are very badly needed. I think one of the concerns, for example, is that food supply chains have been very much questioned now. Many people no longer take for granted. But every time we have had food supply problems in the past, what happens? We talk about 100% rice self-sufficiency, which is really quite unrealistic. And we ignore the fact that Malaysia, despite being on the cusp of becoming a so-called high-income country, actually has some of the worst problems of malnutrition. Not only problems of obesity and diabetes and other problems related to that, but also a huge number of micronutrient deficiencies and so on. So this is just one area of food and nutrition where we can make some progress. But there are, of course, many, many other areas where we can move forward, reducing the size of classes. Now we have a very, very large classroom sizes, which are a heritage from the immediate post-war period, when there were a lot of children who needed to go back to school, and you just made use of what the facilities, you introduced afternoon session and so on and so forth. We are still living in those kinds of conditions. We spend a lot of money on education, but actually very little on the basics of public education for the vast majority of children. Having a school feeding program, for example, could go a very, very long way. But a school feeding program which would be advised by nutritionists rather than by food companies trying to sell their products. These are the kinds of changes which are absolutely needed. Media companies, such as including yourselves, can do much, much more in terms of encouraging healthy behaviors, not only in relation to COVID-19, but a whole range of healthy behaviors. For example, 100% breastfeeding for the first 6 months of an infant's life, and things which Amar can speak about, much more authoritatively than I can. So these are just some changes, and likewise, what corporations like yourselves can do is how do we take the kinds of precautionary measures we heard about earlier, physical distancing, the use of masks, the use of shields, and so on and so forth, to ensure that the work environment is safe. That's why the whole approach should be a whole of government approach and an all of society approach. We cannot just have these partial things of just a combination of the police with the public health authorities, which is the Indian approach. You just beat people up, you give them 4 minutes. 4 hours to go and find shelter, and the rest of it. I mean, I'm sure you've all seen the kinds of measures which have been taken, and neither do you want the Brazilian type of an approach, which has been disastrous, and so on and so forth. So we in East Asia should have been looking east, looking at how other countries in East Asia actually responded to the crisis. But we have actually not done so. If we had done what the other Northeast Asian countries have done, I think the whole crisis would be much less disruptive, and we would have incorporated many of the measures which have been correctly advocated into our new lifestyles.
Yeah. So thank you very much, Dr. Jomo, for your thoughts on that. I think the message and the subtext is clear. There is really no returning to the old normal as a community, as a country, and as businesses as such as ourselves as well. And I think the real challenge for us, as you have quite neatly put it down there, is how do we now re-engineer our business to look at opportunities that this new normal will give us. And you've put in some very interesting anecdotes down there as well. Petty traders who are now pivoting their business model to be more online. And that's where we as large corporations can help digitize their businesses, give them opportunities to pursue these new ways of doing business in a way that's also simplified for them, affordable for them, and also long-term sustainable. Good challenges for all of us to think about. But I just want to quickly pivot that away, and I will come back to the point that you've made about geopolitics on US and China, because it has significant impact on our business as well later. I'll circle back on that point briefly. But I would like to maybe hear from you on just talking about vulnerable segments as you see them from the economic dimension, but also from the social dimension. And I think the economic dimension is quite easily understood. When you shut down everything, you move opportunities or restrict opportunities for people are daily wage earners. But there's the other dimension on that, on the socially vulnerable segments in society as well, Amar. And if we talked about at least the UN global global goals on reducing inequality, which Digi also champions, that's something that we could that we need to pay attention to. I wonder if I can get you to say a few brief words on that, Amar, on vulnerable, socially vulnerable segments in our society that we as large corporations and as citizens ought to pay attention to.
Thanks, Joe. And I appreciate what Jomo said about 50% of our population may be struggling right now, especially the bottom 20%. I think there are many segments of vulnerable populations within our country. The ones that are obvious are our local economic migrants. These are not external migrants, but those who have moved from rural areas to urban areas to eke out a living. Somebody who's gone from Kampar to KL to find a job. It's estimated 30% of our urban communities live in urban slums. That says two things. One, they're economically very fragile, and secondly, their living conditions are not ideal. They are the ones who are more likely to have fast COVID spread through the community. They live in cramped and unpleasant communities. The second group that I have always got hard for are indigenous poor. Currently, they are largely isolated from many of us in Orang Asli villages or Penang villages and so on. But many of them are malnourished. It's estimated that 80% of all Orang Asli children are malnourished. If COVID-19 ever hits any of these villages, they are in serious trouble. And right now, the isolation has helped them. But they, of course, then starved from the support that they usually receive. Thirdly, there's the disabled community in the society. I'm very plugged into them, and there's been a lot of concern from the disabled community not being able to hear the messages correctly, appropriately for their disability in handling COVID-19. Also, many of them have lower income, daily paid jobs, and many of them have lost that, and they need mechanisms and resources that perhaps DG and others could bring on board to get them back. But we mustn't forget the economic external migrants have come to our country. I like to respect them for what they've done. They've built our country. They've helped us, economically move forward. But sadly, we haven't treated them well. I don't think any country treats economic migrants very well as a whole, if you look hard at them. And so we haven't given them a good wage, and their living conditions are poor. And for that reason, we blame them for COVID-19 spread, but perhaps it's the lack of sustainability we put into them. I don't think we can live without migrants coming to our country and helping build the infrastructure in our country. And so we like to invest in them for sustainability. This might mean that we take a smaller profit and so on. Finally, I think there's also those who are in detention in some form, whether it's in prison, whether it's in a refugee camp. We know that our prisons are overcrowded, underfunded, not well developed. We know that refugees in detention camps, their children don't have access to education, and we're worried about their space constraints. I think there's some very quick measures. I'd like to give 4 quick measures that we should do. One, we should revise our national poverty line, and we're so grateful that we've done that just recently. I wish we'd gone all the distance, gone to 3,000 instead of the 2,000 plus, and that would have covered our bottom 40-20%. At the same time, we need to look at our basic wage and up it up. I think we've seen this disparity between the rich and poor growing. I think we need to reverse that. Secondly, I'd like to see mobile health systems grow. We've invested too much in physical infrastructure, I think, to reach groups that are vulnerable, whether they are indigenous, whether they are immigrant, whether they are urban poor. You need mobile health services. A bus that in the front has a registration counter, in the middle has an examination, has a test, and at the end has got medication. It's like a mini clinic that's moving around, and one day could be in Stapak, another day could be in Gombak, and the cost of this is much cheaper than putting up infrastructure. The third thing I'd like to see is for us to invest in urban health equity and housing. We'd really like us to really redevelop our urban communities to have more green lungs, to have more good housing for the poor, good housing for immigrants. And finally, I'd like to see us sign some of the international documents for refugees and migrants. We have not signed this. I think we need to bring a rights-based approach back to migrants. So I think if we do all this, we actually bring back humanity to the bottom half. My concern is this, my big concern, if we don't treat other human beings, wherever they come from, with humanity, our children are going to learn that we are shaping our children by our behavior. And I fear for the humanity of our children.
Thank you, Amar. A short message to us, a very sobering message for us to also just take in and internalize whether we are Digizens, whether we are Malaysians, and whether we are just citizens of this world as well. But Dr. Jomo, I want to pivot back to you very quickly. You touched on some interesting points earlier, which are very critical for our business of telecommunications and any business which is in the world of technology already. And that is, what does globalization look like to you in the next 2 or 3 years, particularly in the context of these large geopolitical deadlocks that we see between generally US-led West and a China or the East, which has largely driven innovation and investment in technology, particularly for telecommunications as well. How do you see this world in the next 2 to 3 year horizons, given the disruptions that have happened in COVID? And these are big decisions that we make. We make decisions, hundreds of millions of ringgit of capital expenditure every year, buying equipment from large vendors, largely driven out of China as well. So very critical for our business. How do you view this?
Thank you, Joe. I think I have been trying to follow a few things, but as I said, you might be better off with an astrologer again. But it is a very difficult world. I think my own view is that the globalization of the last couple of decades of the 20th century and the first decade of this century basically ended with the global financial crisis of 2008. Since then, there has actually been very little expansion of international trade. So if you look at the numbers carefully, it really is, you're really fighting over very limited opportunities and not growing opportunities. So the kind of for example, so-called supply chains, which Malaysians and others like to talk about, were actually no longer growing significantly. Of course, at the margin, they were processes which were involved. China, for example, were relocated sometimes to Southeast Asia, sometimes to Bangladesh, and so on and so forth. So there were a few opportunities which you could sort of go for. And if you think about a number of things, it was really the innovation and chance which gave Malaysia certain opportunities. For example, Malaysia is now the single largest source of imports of photovoltaic solar panels into the US. And this was largely due to the fact that the US and Europe introduced a great number of protectionist measures against Chinese solar panels. And it was really the panel manufacturers in Malaysia, who are all foreign, by the way, who basically seized that opportunity. A panel manufacture involves about 200 odd components compared to 4,000 for say the Proton. So it is something which could have been acquired with the necessary technological infrastructure and preparation if Malaysia had made a determined effort. Yesterday, Indonesia announced that they have done palm oil biodiesel. For those of us who are older, like Amar and I, we still remember that in the 1980s, Malaysia, Porin was announcing, biodiesel from palm oil, and almost every half year or so. But we never moved forward on that. We never really moved forward on that. And since 2006, both Europe as well as the US have moved to biofuels. Again, we were not part of that conversation. We didn't do enough to deal with the kinds of criticisms, many of which were fair criticisms against practices of plantations. And part of the reason why we are so heavily dependent on foreign workers is precisely because we have been allowed to treat them badly. And so it is much more attractive for large plantation companies and many other employers to use foreign workers who work longer hours, who do 3D jobs, and so on and so forth, rather than hire Malaysians to do that work. So we entered a vicious cycle, where many of the jobs which should not exist for a country which claims to be on the cusp of becoming a developed country, a high-income country, should not be there. So we really now, with COVID-19 and its aftermath, it is very likely that some of those, other sectors will be affected. We cannot rely, for example, on importing rice from Vietnam. 7 of the provinces of Vietnam now have, with sea level rising, salinity in their rice fields, which is adversely affecting their rice output. So there are many interconnected problems, relating to sustainable development, which we need to begin to address. And it's, Telenor, for example, in Norway, the Statoil, the principal oil-producing country, now only makes investments in renewable energy. It no longer makes investments in fossil fuel extraction and so on and so forth. So there are many changes which can be made, and both at a national level as well as at the corporate level, which are extremely important for us going forward. So we have to recognize that there are changes which are going forward, that there are changes which might be conducive to participating in some global supply chains, but many of the global supply chains are going to end. For example, it is very clear now that the US government, as well as the Japanese government, have told companies, the US, American and Japanese companies, to get out of China. But getting out of China also affects the supply chains which involve Southeast Asia, for example, because we produce things which go to China, or China produces things which come here and then we assemble them and then it goes somewhere else and so on. So we are going to be affected by that. This targeting of China will also affect us. So we have to be very agile, and rather than talk in very broad general terms about globalization and so on and so forth, we need to have, at the level of serious planning, both at the national level as well as at the corporate level, serious, careful understanding of where things are happening and where things are likely to go. But my own expectation is that in the near future, there will be a further contraction of international trade. There will be a further contraction of external demand for a variety of reasons, not just because of COVID-19, but because of the politics of the world at this point. And this will affect us for some time to come. Even if Mr. Trump is not re-elected, which now is a possibility, it doesn't necessarily mean that these policies are going to change. Mr. Abe will still be there, Mr. Bolsonaro will still be in Brazil, and Mr. Modi will still be in India, and so on and so forth. So we are not going to see a complete reversal, even if Mr. Trump is not there. So we have to deal with the fact that politics is very much part of this story. Public health issues are very much part of the story, and we need to begin to think ahead, but in an integrated fashion. That's why I'm very, very glad that many countries ignored people who said that they had expertise from dealing with other crises. Just imagine if we dealt with this crisis, the crisis which we are experiencing right now, as if it was a financial crisis of the past. There are aspects of this crisis which are almost unique, which we have not seen, for example, since World War II and the disruption which was caused by war. So we really need to get ahead of the game and to think very, very carefully about some of the new challenges which we face in our times.
As you said quite clearly, in some areas we'd be better off consulting astrologers in this. This could be a very good illustration of that point. But a few points that I've picked out on yours as well. Technology provides an opportunity. Just touching on the example that you brought up in Vietnam, and the opportunities we see now in mobile, in e-farming, and the potential of 5G technology and how it can help farmers as well at a large scale. Something very critical for our business also to look at. Secondly, it's really about making sure our supply chain is strong enough to withstand some of these shocks that will come as part of this global geopolitics. But I just want to maybe just kind of bring the discussion to a close, and maybe it's a message from both of you, speaking directly to my colleagues in Digi. You have said, Dr. Jomo, in the past, that this new normal is going to be shaped very much by the sum of what big corporates will do. Could you talk a little bit about that and maybe illustrate, what can we as leaders in a telecoms company, a large telecoms company like Digi in Malaysia, and employees of this company, what should we be thinking of? What is our contribution towards this new normal in the future?
Well, I think what big corporates can do, there's a great deal which big corporates could do, but most importantly, they have to think about how they can contribute to a better world. And this I think is extremely important, because we are not going to return to business as usual, but if we try to return to the status quo ante with all its problems, we are just not learning anything. The greatest tragedy about any crisis, it's not learning from the crisis, and not doing better because we learned from the crisis. Just think about what happened with war, the World War II. We came out, the world was a better world, partly because people came together and they realized the advantages of working together as a nation, and so on and so forth. So all the reforms which created, say, the National Health Service in the UK and so on and so forth, were in a sense coming out of the sense of shared fate which we had. And this is very different from, say, World War I. World War I, precisely because you wanted to humiliate the loser, Germany in this case, we didn't really learn from that. And that created the condition, by trying to humiliate Germany, you created the conditions which led to World War II. So we have to learn from these kinds of things. The world as a whole needs to learn a lot. We as a nation also need to learn a lot about, and there are many problems which Amar and others have already raised, which need to be addressed. At the company level, I think that we still have what are called monopolistic and oligopolistic practices in the country. For example, I think that just to avoid physical contact, even with the handing over of a plastic credit card and so on and so forth, you will need a world where digital payments is much easier. You will need a situation where you have a digital form of Mapensa. The Mapensa is a sort of a system of credit and a banking system which you have in Kenya, which has actually seeped down and involves pretty much everybody. We have a headquarters, the world headquarters of the Alliance for Financial Inclusion is in Malaysia. But you need to really begin to think about how to involve people, how ordinary people, when the what is it called, the My Card was introduced a couple of decades ago. The My Card was supposed to do wonderful things, and it still has the potential to do many things. We have a My Card which can do all those things, including making digital payments, so that we don't go around handing over our credit card or handing over cash where we don't know where the provenance of that cash and so on and so forth. So we want to minimize the possibility of transmission through cash payments, through handing over plastic and so on and so forth. And in fact, plastic is one of the worst ways the virus survives on plastic and metal much longer than it survives on, say, cotton or wood. So these are things which we need to begin to think about. Physical distancing and wearing of masks and shields and so on are extremely important. But we need to go further to think about the kinds of ways in which we can minimize the possibility of disease transmission in the case of COVID-19, but also of making life easier and more secure including for the poorer people. We can cut out a lot of bureaucracy, for example, in terms of all the paperwork which is often required, and the payments of subsidies and so on and so forth. You can use the MyCard to do a lot of transactions which involve ordinary people, the public at large. And this is where I think a company like Digi, which has a lot of experience in other countries as well, through Telenor, can usefully advise the government and others on new forms and practices. We shouldn't say that, oh, we have given 2 or 3 companies the privilege of handling all e-payments, and that's the end of the story. That's not the end of the story. It shouldn't be the end of the story. I mean, you look at China, where almost everything, even a beggar begs, and you pay the beggar electronically in China. Why can't we move very, very quickly without this kind of subsidized privilege for companies? So I think the idea of minimizing the possibility of abuse through monopolies and so on is extremely important, and I hope Digi will advocate accordingly.
Thank you. Very good message on that. And perhaps just maximizing the potential of this thing, which is in the hands of almost every Malaysian today, on both creating new opportunities, but reducing the risk that comes with a pandemic like this as well. And then I go to you, Dr. Amar, for the last word on this. As we reimagine this new world that we live in, business, health and safety, life in general, right? What general principles will you say that will guide us as ordinary citizens as we reskill people on health and safety habits, and especially with regards to children and the elderly as well? And then it's also coming at a time when most of our children are going back to school. So what advice would you give all of us as parents as we prepare to send our children to school as a pediatrician yourself?
Thanks, Joe. It's a tall order to say it in a short time, but could I see the next slide, slide 5, if that's possible?
Sure.
And I will show this slide very quickly to show you how quickly the virus spread. There's lots of data out right now. This is one example. And this slide shows you an individual who came back from overseas, was tested negative in China, then was self-quarantined, tested 3 times negative. But inadvertently, this person was still positive, although despite the test, spread it in a lift to a neighbor without ever meeting the neighbor. We don't know whether it's through airspace or through contact in the lift. And that neighbor then subsequently spread it to her family and went on to 70 people. So this shows you how quickly this one person can actually spread the epidemic. It's fortunate that one person in this chain got very sick and they discovered the rest. Can I see the next slide, please? Slide 6, yes. I put this out some time ago for myself, about 3-4 weeks ago, but I thought it's good to share it with you here. And this is what I think we should do. We should avoid what I consider high-risk situations, or what I call super spreading situations. These are the ones that spread the virus. Of course, minimal risk is staying at home. Low risk is buying back some food or going for a jog. Low to medium risk is going to your corner coffee shop, provided it's not air-conditioned, or going grocery shopping. Kindies with no aircon or going to hospital is medium to high risk. Hospitals, because doctors and nurses are very fussy, that's why it's medium to high risk. But high risk is going to an aircon restaurant, going to an aircon workplace, which many of you are going to a gym or using a public toilet, and of course, traveling in aeroplanes and LRTs and aircon buses. And my worry is that we are now making this 100% occupancy in Malaysia for our mass transport. And finally, the very high risk are places where you talk a lot, you spend a lot of time together, you may sing, and you're in close proximity. That's a bar, that's a party, that's a religious place, a wedding or a conference. And so this gives you some idea of your risk and stratification. Can I have the next slide, please? And so I think the key in going back is this. It's a face mask and it's a face shield, besides physical distancing. Physical distancing is not the easiest thing to do in an office environment. And I've just shown this picture of these lovely ladies in different attire. I wouldn't use an N95 mask. I will leave that for the healthcare professionals. But a 3-ply or cloth mask, both are equally effective. But that's not enough. I used to wear a mask with an eye shield, but I abandoned that largely. And now I moved to a mask with a face shield. And that's what I would recommend for most people. If you cannot, at least wear a face shield. I would think for the DG frontliner, for the person selling his goods in the shop, for the individual supermarket, for the security individual, a face mask and a face shield, I think will protect you extensively. Can I see the next slide just quickly? Slide 8. And this is a lovely study from the US showing two barbers, hairstylists who got infected and were symptomatic, and they had 100 plus clients come to their hand. 67 were tested, not a single one got infected. Why? Because both the hairstylist and every client wore a mask. Some wore 3-ply masks, some wore normal cloth masks. So shows you the power of these items. Thank you very much. So I think
on that note, I mean, I'm glad the barbers and hairdressers have very little bearing on my own life, given my hairstyle as well. So it's just to end on that note. Thank you very much to both our esteemed speakers. We've picked up some really valuable insights for you that will also trigger a lot of conversations that we will have in the workplace over the next few days. A lot of food for thought on this topic. And as we embark on the next 2 days of the Responsible Business Summit, it's just my message to all my colleagues, Digizens. Let's also take into account the sharings that is given by Dr. Jomo, Dr. Amar, into all facets of responsible business that we as Digizens need to sort of internalize, but also champion with our teams. We've gathered an amazing lineup of speakers covering topics that are linked to our strategy, while remaining relevant to our own personal lives as well. So I hope you take part in these activities, log on to the sessions or join the watch parties and have conversation with the hosts as well, and share some of your takeaways on the workplace. But most importantly, enjoy the learning process. So once again, Dr. Jomo, Dr. Amar, on behalf of Digi, our appreciation to both of you for coming, sharing your time, sharing your thoughts. Thank you.
Thank you, Joe.
Thank you.
Good morning, Digizens. I hope you enjoyed that good chat, good panel session that we've had with Dr. Jomo and Dr. Amar earlier. Obviously, that wasn't a live session. We didn't go in time to change our shirts and change venue in the case of Dr. Jomo as well. But we wanted to have a really good discussion to share with you this morning. And I've noticed a lot of your questions coming in on the chat group as well. I've collated some of that to be asked for panelists today. Joining us this morning as well are the two panelists from last week's recording, Dr. Jomo, Dr. Rama. Gentlemen, thank you so much for your very enlightening thoughts last week. Thank you for joining us on this live Q&A session with Digizens today. I will hand the floor right now to another gentleman that's joining us. Albin, our CEO, is on the call. Albin, I see your mic is muted, so please unmute it before you begin. But can I just invite you to say a few words to Digizens on the topic of responsible business at the Responsible Business Summit, and then some reflections as well on the discussion that we've had so far. What are your key takeaways from this?
Yeah, thanks, Joe. Good morning, Dr. Jomo, Dr. Amar, and fellow Digizens. Fantastic to have both of you kick off a very interesting day for us called Responsible Business Summit. It was great to have you kick off the session, and it was also nice to see a lot of interactions from Digizens on the social media going on, and a lot of questions, a lot of curiosity on what you guys have shared. So thank you very much for taking the time. Okay, and it's great to see you all live again after our last catch up. So to Digizens, welcome to Responsible Business Summit. It's great to see so many of you, almost 1,000 of you were online just now, and I know some of you are in the studio. So really, thank you for taking the time to go through this, not just the keynote address, but also some key topics that we will cover for responsible business. And as you know, this is something that we dedicate ourselves time every year to do. This year, virtually, of course, because of COVID-19 pandemic. But it's not lost its engagement, it's not lost its prioritization in our company, and it's definitely not lost the way it's integrated in the way we work. And so responsible business, guys, is super important for us. And for me, personally, this is something that we do continuously every year to spend some time to also just reflect on what are the areas that we can improve on, what are areas that we as corporate citizens in this country can do, but also what are we as Malaysians, what do we own, society and the country in general. So many different aspects of it to look at. Responsible business covers a huge area for us, huge area, from governance to the way we work, to our supply chains, to the way we interact with our customers, to the way we look after employees, the way we govern ourselves as a brand. And all those things reflect on the brand, guys. And I want to leave you all with one last sentence, which is yellow heart, which is why we've integrated the brand so closely with what customers see us and perceive us to be on the outside. And so it's so important that when we walk around, we not only think that we're Digizens only in the office, but we're also Digizens when we leave the office and when we're at home and when we're everywhere else. We live that brand and we live that value of responsible business. So with that, today's session was really inspiring for me. Personally, we are in a pandemic. Personally, we're getting out of it. Personally, Malaysians need to think about how can we step up our own responsibility in making sure that we don't let our guards down, but also not forgetting if it happens again and the second wave or the third wave hits again, what will that impact be on people that are much more vulnerable positioned than us? And how can we actually step up our responsibility to prevent that as much as we can? So, Joachim, some quick reflections. Back to you, and thank you again to Dr. Jomo and Dr. Amar being here with us today. Joe,
thank you, Albin. Also joining us, apart from more than 1,000 Digizens, a couple of our directors, independent directors who sit on the board. So Tan Sri Saw was on the chat this morning as well, watching the dialogue, and Puan Yasmin, who also sits on our board, was here today. So thank you, Tan Sri and Puan Yasmin, for joining us. And then a lot of questions for the panelists today. So I'll turn quickly to the both of you. A lot of questions came in on the testing side of things, Dr. Rama. So maybe I'll pass over to you. When I picked up the newspapers this morning, I saw this testing targeted approach bearing results. So kind of like listening to you, what you had to say last week as well, on being a lot more targeted on the testing. There are a couple of questions that came from Digizens. First one came from Angie, and she said, your view, Dr. Rama, will there be a second wave in Malaysia, predominantly in densely populated areas? And then maybe I could also ask you your view as a physician on testing itself. How often should it be done? Every 2 weeks, is that sufficient? Is that too late? Is that preventive enough? And is the lack of testing also, in your view, the reason why our cases, our reported cases, are kind of low today? Then in sort of reflecting that, I also looked at your tweet this morning, and you put in a very interesting tweet. You said, reality is we have only had one wave. Most countries will experience a second wave. It's not if, but when. Safe physical distance is crucial, but insufficient unless all wear masks outside of the home, and super spreading is a risky situation which should be avoided at all times. Dr. Rama, your comments, please.
Thank you very much. So I think you've summarized that in the tweet that I sent out this morning. I partly did that because I've been watching what's happening to all of us, and we become very relaxed. If you see an article that Frankie de Cruz wrote in Free Malaysia today about how nightclubs are starting to quietly open and people are getting back to, you know, a busy kind of life. I've also watched many people not wear masks, including our leaders, which worries me a little bit. We're sending a message that we are relaxed. So coming to the situation about the second wave, it's not if, it's going to be when. We're not going away from COVID-19. It's going to be here for 2 to 3 years. Vaccines are not an immediate hope. So there's no way we're going to live with this closed borders. And from some of the work I showed earlier, 1% is all that you need to spread. If you look at yesterday's press release from Ministry of Health, there were 7 individuals who tested positive who had no contact with anyone else, which means they are community spread cases, and we don't know where they got their infection with. So there's low-grade spread in the community. All it needs is super spreading events, busy events where we don't take precautions, and it can ramp up. Regarding testing, I believe that the people who need to be tested every 2 weeks are healthcare professionals. And which healthcare professionals? All those who are not working in office, but working in the wards or in the clinics. They are the ones who are going to be infected first if they let their guard down. And these are the ones that we should offer testing every 2 weeks. If you had enough tests, I would suggest that we consider frontline people like, you know, someone serving at a DG frontline counter, someone serving at a cashier or a frontline supermarket or grocery store. Those are the kind of individuals that probably once a month I would like to test. Our problem right now is that, as I've said, we've stagnated in our testing. We've not even reached 40,000, and currently we're not even using 20% of those tests every day. So perhaps we may be self-fulfilling our prophecy. If we don't test widely enough, we get very small numbers, and that may breed some degree of, you know, false reassurance to ourselves. So I believe that we should test more widely, test the correct individuals. Even if you look at our migrant worker testing, it's been very small. We haven't even tested 50,000 migrant workers yet, compared to perhaps 4 to 6 million individuals in the country. So wider testing, ramp up our testing, test target, and test some people repetitively. Yes. I hope those answered most of the questions. Did I miss any?
No, I think you kind of covered it all quite eloquently. Thank you so much for that. So lots of testing and vigilance for all of us as citizens as well, just to keep that up. Dr. Jomo, thanks a lot for your thoughts as well during the panel session. I have a question here from Alex. Alex is our head of strategy. And he asked, what are the possible parts of recovery from your point of view that will indicate some sort of recovery on the economic side of things? What are the key drivers that will tell you that countries are slowly starting to recover from this, from your point of view?
Well, I think the major difference in the world, unfortunately, continues to be that between East Asia, broadly speaking, and the rest of the world. East Asia responded with very prompt, early precautionary actions. Case of countries which could afford it, like the Northeast Asian countries, Japan, Korea, Taiwan, even parts of China, there was very, very extensive testing, as Dr. Amar has eloquently emphasized. Even for poorer countries like Vietnam, as well as Kerala state in southwestern India, there has been much more targeted testing. The vulnerable, the most likely populations have been tested on a precautionary basis. And the Chief Minister of Kerala, for example, recently announced, I think a couple of days ago, that there is a resurgence of cases. Kerala was the first state, but has been exemplary in terms of the first state in India, but has been exemplary in terms of taking needed measures and so on. But now the Chief Minister is actually announcing this, whereas most other Chief Ministers in India are actually almost in denial. They prefer not to announce, and we cannot be like the ostrich in the sand, or head in the sand, denying the possibility of cases just by not testing. Trump says this, and many other people say it, and I think there is some truth to this. One of the particular areas I'm particularly concerned about, as far as Malaysia is concerned, is the whole question of the migrant workers. Many of your clients, of course, are migrant workers, and 2/3 of migrant workers, according to a previous human resources minister, working with the telco companies, 2/3 of them are actually undocumented. Now, some of them have left in the last 3 months, especially those from Indonesia, but many others are still here. And if we continue to take a very harsh approach to them, we are driving them underground. And if you look at what happened in Singapore, the resurgence in Singapore of the virus was precisely because many migrant workers felt insecure. Now, in the Malaysian situation, they feel even more insecure because they're undocumented. So I think we have to take a very, very different approach. And actually, it's an approach provided for by policy and by law. And that is that everybody who feels, who suspects that they might be infected can come forward and get tested without being charged an enormous amount of money and so on and so forth. But I would add an additional incentive, that is to give anybody who comes forward a 1-year work pass. So this way you legitimize and you bring people forward. More and more people will come forward, you legitimize them, and this is probably the only way we can decriminalize and make sure that the migrant workers do not become a source of the resurgence of the virus. Now, coming back to Alex's question, I think we have a very difficult situation where, in many ways, what we have done has been quite good by some international standards, but could have been better by other standards. Okay, so I think we have to put these things in perspective. The ability of the world to come out of this is a huge problem. As I said, East Asia, we seem to have had some prospect of recovery. The recovery in China, for example, in recent days has been actually quite good, and so the market is responding by moving money around and so on and so forth. I think we need to recognize that recovery is not going to be easy. I completely agree with Dr. Amar that even if we have a vaccine available in the next few weeks or months, that is not going to fundamentally change the situation. The current situation is such that there are certain powers which seek to control the vaccine. In fact, they already control a lot of some of the PPE, the personal protective equipment, and so on and so forth. So at precisely a time when international cooperation and solidarity is very, very badly needed, we don't have that. In fact, we have quite a bit of finger pointing, and this is going to be problematic. So we need to have because a lot of the problems are politically driven. If you take, for example, the whole problem of firms, Japanese firms and US firms being asked to withdraw from China. And that will affect the supply chains which involve countries like Malaysia. And this will affect our ability to produce and so on and so forth. We also have ongoing problems which have been highlighted. For example, the fact that rice production has actually plateaued and is unlikely to increase. And we've had high levels of high sea levels, which have seeped salinity into the Mekong Delta, and that is affecting our rice imports. So there are a range of problems, and we really need to think in terms of ensuring that much more of our food is produced. I'm not looking at 100% rice self-sufficiency or anything like that, but I think we have to have a much smarter policy, and we have a huge number of problems relating to food, relating to diet, relating to obesity, relating to diabetes, and a whole range of other things Dr. Amar can talk much more about. So these are self-inflicted problems, and we need to change our food behaviors and so on and so forth. So I'm much more concerned about how we make use of this opportunity to actually change our new normal. I think we should stop trying to think about going back to business as usual or anything like that. That is an unlikely scenario to begin with, but it's also not a desirable scenario because it has been very problematic for a range of reasons. What I think we also need to think about in Malaysia, you know, we have a situation where people have money, but they're not willing to spend their money because there is a certain precautionary element. People are thinking about, you know, the possibility that there will be a resurgence of the virus, but also just generally speaking, people Malaysia has a very high level of household debt, and people are concerned about their ability to service their debt because they're going to lose their cars, they're going to their vehicles, they're going to lose the possibility of losing their houses and so on and so forth. So there are a range of problems which need to be thought about, and the Prime Minister has been asking people to spend their money, but they're simply not going to spend their money just because somebody tells them to spend their money. They are going to be thinking about their prospects, and I think what has helped certain politicians, both in this country as well as elsewhere, has been precisely the fact that they have been seen to be sensible. If you think about, you know, the Prime Minister has allowed Dr. Noor Hisham, the Director General of Health Services, to provide a certain degree of calm, you know, reassuring the public and so on and so forth, not politicize the whole thing. And this has been very much appreciated by much of the population. But it's not clear whether the population is inspired by the rest of the cabinet, for example, and of course is a problem. So I would really say that you know, Alex, that we should think very much about moving the economy, of nudging the economy in a more desirable direction, including, for example, spending much more on public health. We should be doing much more in the public health area, and in fact, one of the ways in which you can actually ensure that spending will go on is, for example, introducing a school breakfast program. All schools will have or a school lunch program where every child in school would have a meal, a very healthy meal, which the MOH would determine rather than the food companies, which is the case. And this will be for everybody, so there would be no sense of deprivation, of shame in terms of getting a handout and so on and so forth. This is being done elsewhere, and this is something which Michelle Obama, for instance, tried to do when she was First Lady, not very successfully for various reasons which I won't get into. But I think there is much we can do to try to improve life in this country. It might not be reflected so much in terms of the normal financial indicators, but I think we should be thinking much more about well-being.
Yeah, thank you, Dr. Jomo. Just staying on that point as well, you touched towards the end of your comments about inequalities and how we can use this opportunity of the pandemic to even further reduce the inequalities, bring everybody back to the same line. And some have posited that this is a greatest opportunity for the world to look at how we can sort of hit the reset button and bring people back as close as possible to the starting line together. Firstly, do you agree with that position? And secondly, if you do, are there areas that Malaysia can pay attention to really take advantage of this, everyone coming on the same starting line? One of my colleagues, Mr. Cheng, who's the head of consumer sales, he said, what about investing in the Malaysian education system? Could this be the launch pad that takes us forward, and is the timing right now? Dr. Jomo, your comments, and then I'll hand the mic to Dr. Rama on the same question as well.
Yes, thank you. I think that's the way to begin to think. I mean, you think about some of the measures and who benefits from the measures. We know, for example, the low interest rate policy practiced by the US Federal Reserve Bank has been very beneficial for the richest people in the US and some of the richest people in the world. So what we have seen is actually inequality has increased, wealth concentration has increased during the last quarter, during the period of the response to the COVID crisis. That is precisely what we are not trying to do. The rich people are not going to spend much more, which is precisely what you need to do to kickstart the economy. We have also seen that in many countries, there has been a neglect of the specific problems of the smallest businesses, the family businesses, and so on and so forth, petty businesses, the problems of hawkers, and so on and so forth. And we have also seen a neglect of the daily rated workers who if they don't work, they don't get paid. Many of these people have been the most neglected. In Malaysia, we don't have such a huge informal sector, but I would estimate that probably at least a third, the lowest third of the population has been adversely affected. In some countries with much larger informal sectors, unfortunately, much higher proportions of the populations have been affected. But we have also seen how targeted approaches can make a difference. If you look at I refer again to Kerala state, but let's take another case, the case of Argentina, where you had measures which were directed particularly at the poorest. Whereas in this country, what happened? You see, the measures were directed to the formal sector, and the formal sector needed help. But there was not very much done for the informal sector, unfortunately. And so we have had a serious problem. We also need to recognize that certain activities, certain businesses are basically not going to go anywhere but south. So what do you do with them? We have to basically rethink what to do with many of these businesses. Retraining the workers on the one hand, and repurposing the buildings, the infrastructure which already exists, and so on and so forth. At the same time, there are also new business opportunities which are there. And there should be some encouragement and nudging to make sure that these things happen. For example, just to use a simple example, everybody envisages that we will need much more payment systems which are not cash payments, where you are in touch with currency, or using credit cards. We need some other forms of payment which are going to be which can be easily available to everybody. Now, we all have had, for at least 2 decades, My Cards. Why can't the My Cards be used and repurposed for as a payment system? Why do we need private companies to handle these things? At the same time, there will be the need to work with telecommunications companies to ensure security of payments, that we don't have people defrauding, going around using somebody else's My Card and so on and so forth. So we need to work all these things out. That's why we need an all-of-government approach, as I tried to emphasize in the earlier segment, and we need to involve the whole of society. Consultation with all of society is extremely important, and this, I think, will be very important to going forward. Let me stop here.
Thank you, Dr. Jomo. Then, Dr. Rama, the last word on you. How do we use this as an opportunity to reduce inequalities in society, as you see it as well?
Thanks, Joe. And I think I mentioned it privately, but let's say it publicly. I wrote an article about 2 months ago, which I haven't put out. It's talking about how the fact that we actually have no new normal to move to, because we've never actually lived a normal life. We've actually lived an abnormal life as a society. What do I mean by that? Our society's been actually sick for a long time. We've elevated the wrong things in terms of success. We've actually been fairly greedy and corrupt. Most of us actually look to ourselves. We're actually not really a community anymore. People are always trying to move ahead as society. If you look at H.G. Wells' marvelous prophecy in the science fiction book, Time Machine, he talks about going into the future and seeing two distinct societies, the Eloys and the Molochs, the haves and the have-nots. And we actually reached that kind of situation in most countries, including our own. There are those in this crisis who are able to cope because they have wealth and reserves, and there are many others who are absolutely in destitute poverty and are struggling. So we actually live in an abnormal society, and we have an opportunity right now to move to become a normal society. But this kind of change is extremely difficult, I believe, because we don't want this kind of change. It's sort of almost alien to us. I was listening to Jomo just now, and you're asking him what we can do. I was thinking of wealth sharing as a very important part of this time. But are people prepared to share their wealth with others with no conditions? My wife and I have been trying to do that as much as we can in the past, but especially accelerated at this time. How much money do you really need to live on? I calculated, and it's actually a very small amount that you need to live on. But much of our life is now, loaded with luxuries and stuff like that. So I think change is extremely difficult. Most of us are not prepared to embrace that kind of change. So we live in this psychotic kind of society. Psychosis basically is out of touch with reality. And that's what most of us are. We are chasing a dream. I like this lovely quote from a Sifu of mine, and let me read that. Sifu is a wise sage called Thomas Merton. And Merton says, people may spend their whole lives climbing the ladder of success, only to find once they reach the top, that the ladder is leaning against the wrong wall. And that's the problem with many of us. We may chase many things in life, put our ladder against success, acquisition, power, wealth, and so on. But when we reach the top of that, we find that actually it's quite empty. I benchmark success in life for myself in three ways. Firstly, I have a good relationship with God. Secondly, I have a good relationship with myself. That means I know God and I know myself. And thirdly, I have a good relationship with a few people around me who are very good and dear friends who I can trust enormously. And that's a high benchmark for success. Very few people can reach that kind of level of success. So we live in fragmented societies fragmented by wealth disparity, fragmented by gender and religious issues, fragmented also by our racial issues. And we need to use COVID-19 as a reset, as we've talked about. It's inadvertently given us a gift. I don't think the virus planned any of this, Although in my article I suggested perhaps it's the consciousness of Gaia, the whole earth, trying to tell us that we are gone mad and psychotic and time to please stop and revert back, because the most dangerous creature on this world is mankind, destroying the world that they live on and destroying all other creatures. So it's a time now for us to actually come back to reality, come back to know your neighbor, come back to know others, perhaps share the wealth of our earnings back into community. As I mentioned to you, perhaps time for GG to actually reinvest in the people who work in the organization. Perhaps don't make that much money. Why not invest the money back into the people who use your services, as well as the people who serve you in the organization, and decrease the wealth disparity. I spent some time in Rotterdam, and I had a lot of conversations with people on the street, and I was pleasantly surprised when I talked to a sanitation janitor, rubbish collector for us here. And he'd come up from university, and he chose to be a sanitation janitor because it's an important valued job. And his pay and the doctor's pay was quite close. They valued his occupation. Today, we seem to value certain things and not value the common person. I like to value the factory worker, I like to value the paddy planter, I like to value the person who puts fish on my table. I like to value teachers. So it's time for government also to change, come around, stop building buildings that are meaningless, stop building bigger, grandiose, things like Putrajaya. Every time I go to Putrajaya, I feel nauseous looking at the amount of wealth we have wasted. Why don't we invest in the three most important sectors in our country? And what are they? Health, education, and welfare. And we're actually very pitifully investing in any of this. Our health expenditure is very small. Our schools are in very bad shape, and we should have single session schools all over. And I look at Sabah and Sarawak, where I've worked, that schools are in very, very bad shape. And finally, welfare is probably the single worst ministry in the country in terms of funding and manpower. Only 2,000 welfare officers to serve child abuse, look at people who are poor, and so on. That's really a very small number. So I think if we do all this, we could turn around. But it requires not just the top change, which is a difficult change because they're politically not very stable and they're looking for for security, but it requires a change from the ground. I think if we change who we are and how we look, if corporations like DG perhaps turns around and say, we're not playing the Maxis and the Celcom game, but we're actually going to reinvest our wealth back in the people who in the organization, perhaps people might want to emulate such a thing. There's a guy called Ricardo Semler that I'd like to mention to all of you. Worth going and looking at his TED Talk, Ricardo Semler, How to Run a Company with Almost No Rules. It's a wonderful talk talking about how to invest back in the people that you serve. And surprisingly, you make even more money than you had before, because now everybody wants to serve the company because they love working where they are. So it is a reset button. And I hope that we will use this button, or otherwise we will lapse back into our prior psychosis.
Thank you, Dr. Amar. Thank you, Dr. Jomo. And on that inspiring note, we also bring this session to a close. Few very good messages for all of us to take away. Take a sharp look at ourselves, firstly as citizens and as individuals, but as also in our roles in DG and how we can make the ecosystem that we play in first, how we serve customers, how we build much more inclusive workspaces, how we include even other sectors of society, segments of society, in the participation of the greater economy, how we create access for small businesses, but also individuals to participate in this this borderless world as we see it. And of course, within our roles itself, how do we make sure that we drive the values of responsible business, engaging with supply chain, and engaging with the people who run our business, our subcontractors and the contractors even below them, how we uphold human rights, of course, how we look at good conduct in our business as well, whether you define that as anti-corruption, whether you define that as good corporate governance or whatever you call it. So I hope you take the opportunity to listen in to all the other speakers. We have 16 masterclasses, really good speakers who have come in to talk across the range of topics on responsible business. Enjoy the next 2 days and all the best. Thank you.
Thank you.
Thank you.
Thank you, gentlemen.
Okay, gentlemen, are we still on?
Yes, I'm still on.